The Univers 2 Glenoid version correction set is housed in one small instrument case. Including a simple set of instructions describing how the guides are intended to be used and function. This set is typically used to correct excessive retroversion. Posterior glenoid wear develops over time in shoulders with tight anterior structures. The degree of wear may be determined by a preoperative CT scan. With excessive retroversion, it may be necessary to preferentially remove mostly anterior glenoid and minimal posterior glenoid. The proper size guide should be selected from the 4 available sizes. The correction guide, which most closely matches the glenoid surface area, is preferred. Here, the large guide is almost a perfect match. Each size has a 5, 10, and 0 and 15 degree guide. There are 4 sizes: small, medium, large, and extra large. With the 5 degree guide, bone is removed opposite the arrow. With the 10 degree guide, bone is removed on the side the hole is positioned. With the 0 and 15 degree guide, 0 degrees is a normal glenoid preparation for no excessive retroversion. The 15 degree hole is like the 10 degree hole. Bone is removed on the side the hole is positioned. As an example, assume we have a glenoid with posterior glenoid wear with 5 degrees of abnormal retroversion determined by preoperative CT scan. We need to remove bone along the anterior aspect of the glenoid to bring the glenoid anatomy back to normal. We chose a 5 degree guide, appropriately matched to the size of the patient. Since we want to remove anterior bone with the 5 degree guide, we choose a 5 degree guide with the arrow pointed posterior. If we wanted to remove 10 or 15 degrees, we would choose the 10 or 15 guide and place the guide wire in the hole closest to the anterior glenoid rim. As you can see, the posterior glenoid rim is basically untouched, while the anterior glenoid has been preferentially removed. Following version correction reaming, the pegged or keeled glenoid guide number 2 is used to complete preparation of the native glenoid, prior to implantation of the actual glenoid component. The Univers 2 glenoid version correction set gives the surgeon a system to correct excessive glenoid version with precision in a predictable and controlled manner.